So everyone, we have been having conversations with our board members, so you get to know them a little bit better. We spoke with Michael Kaluva, Therese Lane, and now I'm happy to be speaking with Emily Sirotich, who joined the CAPA Board of Directors last year. Welcome, Emily. It's really nice to have you here.
Thanks, Lori. It's great to be here and get to share my experience with CAPA with the world. So thanks for having me.
Sounds great. So tell me a little bit about yourself.
Sure. So my name's Emily Sirotich. I am a person from Toronto/Hamilton region, and I am a full-time PhD student at McMaster University and a researcher by training and by, I would say, passion as well. So I am doing my PhD at McMaster in health research methodology, and that is my that's my full-time job. And on the side, I like to do a lot of research in different things, rheumatology, other types of work. And for fun, what do I do for fun now? Paint by numbers is the newest thing that I've been getting into. So I've been enjoying that. So that's about me.
I know we've all been getting into different things, I guess, during the pandemic. So I'm glad you found something different and unique, right? We're also home now.
I'm getting excited for the summer when we can start biking and going outside. So that will be nice.
Definitely. I'm going to switch gears here and go back to this. So tell me about what motivated you to get involved with CAPA, or the Canadian Arthritis Patient Alliance.
Yeah, so that's a really good question. I got involved with CAPA, I think it was through you, Lori. So my first exposure to really the arthritis community was through Twitter, as I found that a lot of exposure to the science community has been through. So I started to get involved or look around what's happening in the arthritis community through Twitter in early January of 2020 / December 2019. And I believe I reached out to you and I introduced myself to you and I said, I've been really interested in getting more involved in arthritis community and patient community work. How can I do that? And you introduced me to the Canadian Arthritis Patient Alliance. And I was immediately impressed by all the work of this organization and all the amazing representatives and board members and initiatives and activities. So I think I sent a quick email and said, hi, my name's Emily, and you were able to introduce me to the rest of the CAPA team. So that was my first introduction to CAPA, and it's been over a year since.
I know, it's hard to believe. And we're really happy that you joined us.
Thank you.
That is for sure. So tell me about some of the projects that you've been involved in, what's been your role, and, because I think you were because the pandemic sort of started almost immediately upon you joining the CAPA Board of Directors. It turned into some pretty big things, I think, for you. So
yeah, it's been a crazy year. I definitely did not expect this type of year to come about, as I'm sure nobody did, but it was a crazy introduction to, I think, the arthritis community, patient communities in general, and just, organizations that are like helping patients and speaking for patients and allowing patients to have a voice. So I was involved with CAPA starting in January of 2020, and I had about 2 months to get used to things. I think I went to 2 meetings or so, or 3, and then the pandemic hit in March of 2020. And honestly, it was crazy how things really picked up. So I think I mentioned that I was introduced to CAPA through Twitter. So on Twitter, the medical community or the science community was really going, and I don't even know if I would say crazy. We were so, concerned and interested in seeing what was happening with this pandemic and how it would affect our different communities. So March 2020, I actually became involved with the COVID-19 Global Rheumatology Alliance. So since March, I think it was the 13th or 14th of March of 2020, I've been working with the Global Rheumatology Alliance, and I've been a steering committee member as a patient engagement lead, and I also chair the patient board of the organization. 2020 was really that push into different projects where the arthritis community was able to focus really on COVID-19 and how it was impacting not only their lives in terms of, being able to go out or their potential risks, but also thinking, well, even though you might not have COVID yourself, everyone is worried and your other things in life are being impacted. So what does that mean for patients with arthritis? So that was my immediate project that I was involved with while being a CAPA board member.
Right. Yeah, and I know the, COVID-19 Global Rheumatology Alliance has come out with a lot of different important publications, right, to help identify some of the issues for people living with arthritis, the effects. Like I know, for example, I think it was you and others with the, Alliance invited me to be a co-author on a number of different things. So including, the hydroxychloroquine drug shortages.
Yeah.
And so there's been a lot of good evidence, right, to support people living with arthritis. And so we know more about people with arthritis through the pandemic in different ways. So
yeah, exactly. I think the hydroxychloroquine phase of the pandemic was definitely interesting for people in the rheumatology community, since you see this drug that people could be taking, for their normal conditions, being used or repurposed, and the potential effects of people in the rheumatology community. And I think it was really scary, and to be able to be a part of a community, not only just in Canada, but around the world, who are able to really show, we need to make sure we're doing things properly and we're considering the potential impacts. It was really a great opportunity. And I'm glad I got you involved and others in CAPA, but in Canada as well. So that was really a great project, I think.
Yeah, it was. Yeah, definitely. Between researchers and rheumatologists and epidemiologists and, everybody sort of coming together. It's great to see some positive coming out of the pandemic, right? It's like
exactly
people who never worked together before is thrust together towards an important cause, right? An important goal.
Yeah, I totally agree.
So I know there are many patients involved as patient partners, like myself and others on the steering committee. And so like what role, given some of your experiences and all that, like what sort of role do you see for patient leaders now and into the future?
Yeah, that's a really great question. So I think the COVID pandemic has really introduced or pushed to the forefront the power of what being a patient means. So not only do you get to have the insider knowledge of living with the disease and understanding what it means to, go through your daily life and have to function with a condition, but you're also able to see, you're speaking to other patients, you're speaking to other community members, rheumatologists, and you're bringing all your knowledge, and you're able to highlight that and say, this is something that we need in our community to make our lives better. So I think the COVID pandemic really pushed the real impact that patients can have, not only as participants, but people who lead projects and can put together a team of people that they know have the right, the right focus in mind, the right dedication, the right motivation, and can do a project well. And it will be something that will be there for patients and will help their lives. And I think patient leaders are not only important for moving a project forward, but leading a project and being there during its inception at the beginning as well. So hopefully we will see more of that coming from the rheumatology community, but all patient communities.
Yeah, no, and I think you occupy like a key role, right? Is sort of taking that sort of patient leader and patient empowerment roles further. Right?
And one of the, I think, really important pieces of the COVID-19 Global Rheumatology Alliance was being able to put together a survey for patients to take. And it was created by patients, it was designed by patients. I consider myself a patient partner and someone who works with the community and works closely with patients. And I was able to meet new people and bring them on the team and make sure all of those questions that people wanted answered were something that was being considered and incorporated. So I think I totally agree. I hope I'm one of the leaders, so I appreciate that.
No, definitely. Yeah, and it shows how, patients out there, generally are there, and it's important that they're there based on their lived experience in that. But we can also be much, much more and bring more than those lived experiences, because we're not just bringing that hat, right? We have like a whole set of skills and different things. People are, might work in promotional things. They might be, doing PhDs in health research methodology. They bring all of this to the table. So it's really nice to see that is valued. And
Thank you.
And
I think being a patient is a part of our lives, but it doesn't define who we are. And a lot of patients have full-time jobs that are unrelated to being a patient, and means that they have a developed skill set and they are the professionals in a certain field of whatever field that is. And I think it's really key to bring in these community members together and use that skill set that they already have in this other area or even in the same area, and making sure that we're doing projects well, and including people where we can. So even if you don't have enough experience, you don't have experience in research, it doesn't mean you can't participate.
Yeah, for sure. For sure. No, and it's nice to see that, it's, brings their diversity of skills, their diversity of lived experiences, sort of all to the table. And yeah, hopefully we can all support them so that they can understand and be able to meaningfully, contribute to things.
Yeah.
No, for sure. And I think it's a great example. So what advice, would you give to people living, with arthritis about getting involved and making contributions like, you're making, or myself, or, there are many other, many other of us, including many on the CAPA board. So
I think a really important piece that helped me is connecting with someone who's in it and asking them, how can you get involved? So you were my gateway, I would say, to the arthritis community. You are still someone I look up to, and I say, Lori is involved in so many impactful projects. How can I do what she's doing in my own way? And I think being able to find like a mentor or someone who you can look up to and model yourself with is really important, so that you don't feel disconnected or that you're not contributing. So I think number one is finding someone who you would like to be like, and making sure you connect with them. And they are always open to hearing from people who want to get more involved. So I think number one, connecting with those people. Number two, don't limit yourself on what you think you're capable of. People are capable of a lot, and you don't have to have a certain skill set to get involved. I think it's so important to have people from, like we said before, different walks of life and different backgrounds to come together and talk about their shared experiences. And I think that's really important. So don't feel limited or don't feel excluded because you only have certain skills. I think all skills are important, and it's just how are we going to use them. And number three, I think stay motivated. I think one thing that keeps me going is knowing that the work I do will help others who are going to be coming into this world, fortunately or unfortunately, and keep continuing to work and be a part of it will allow newer generations in 10, 20, 30, 40 years to be there and have them have questions that we wanted answered already answered for them, and then they can start asking the next question. So I know even on our CAPA board, people have been involved for so many years, and I really look up to them, and I wouldn't have the quality of care that I have today or other people would have in whatever other medical community without the patients who've been there before them. So I think just thinking about, future generations and how a small involvement can be impactful is really important.
No, I think very, very well said, Emily. I feel very much the same way when I look at some that have been a mentor for me, and they've really sort of opened the door. And I guess we're there to kind of keep it open in perpetuity, and then hope that others will follow us through. So definitely,
I totally agree.
I could make that connection for you into this world. So.
No, it was great to have you. And I always tell everybody you should be on Twitter if you aren't already. It's such a great opportunity to talk to people you might have not have spoken to who have similar interests. So I really liked that. Yeah. And if I can, I'd really love to talk about why I chose CAPA. It might not be a part of the questions necessarily, but I think it's really important for me to say it as well.
Let's circle back to that then. What motivated you to choose CAPA as opposed to something else, right?
Yeah, and I think number one, I thought, well, even just at the beginning when you're entering, you get so excited by all these different opportunities that you want to join everything, and I think that's possible. So I don't think having one membership will mean that you have to stick to one organization versus another. So for example, I do the Global Rheumatology Alliance work, and I still am a CAPA board member and able to bring those two experiences together. And I'm sure there's other Canadian organizations that are great too. I think CAPA for me, what it represents is a community feel and people who are there, who are kind, who understand difficulties come up in life and are able to be considerate and supportive no matter where you are in your journey. I think that's number one, or just the types of people who are involved in CAPA. But number two, what I'm really impressed by CAPA about is their willingness to advocate and really push what is the norm. So for example, when we're talking about drugs that are approved for, arthritis treatments, we wouldn't be where we are today without people in the past advocating for access to drugs. And I am so impressed by CAPA for their continued efforts to make sure people have access, that people have options, that there is care out there, and that there's standards of care. So I think CAPA is not only community, but it's an advocacy that I haven't seen, and I am so impressed by. So I think CAPA was really a lucky chance for me, and I'm so happy to be involved.
Well, we're definitely happy to, and I feel very much the same way. Even in terms of some of my access to medications, I don't think that would have been possible without, like honestly, CAPA President Linda Wilhelm, who knocked on the doors of the MPs and was really there, right? It's funny because to me, sitting like a few provinces away, little did I know, she was working tirelessly in New Brunswick and beyond, trying to, gain awareness of those issues. And then I ended up being able to get access sort of before it was actually on the market as well. So definitely.
And what's crazy is for the new generation coming in, I didn't even know there was access issues until I became involved, and I saw the history of how we've come so far, and it's given a lot to patients. Those, Linda, even her, she has been so inspirational and a role model for how you can really improve the lives of patients. And it's just been an honor to work with everybody, I think.
Yeah, for sure. No, I agree. Very happy to have the privilege of working with Linda and the rest of the board. And thank you so much for joining us here today.
Anytime. Thanks for having me.
A great conversation, and it's nice to see it from hopefully the next generation of advocates that'll take over from us. Thanks so much.
Work beside you first, and then maybe take over.
Yeah, exactly. Thank you so much, everyone. Goodbye.
Bye.